Falls are common and costly and a growing public health concern, particularly among the aging population. Every second of every day, an older adult suffers a fall in the U.S., and the Centers for Disease Control says many older adults have a fear of falling because it can lead to a significant injury, disability, or sometimes death.
We give you insight into the programs helping older adults live safely and independently in their own home. Don Johnson knows the pain of a fall.
I fell in October a year ago and destroyed this shoulder. There's 4 tendons hold it together. 3 of them are torn and 1's gone.
On top of that, Don has multiple sclerosis and he's lost his sight. His wife Linda is a stroke survivor and, like her husband, is in danger of falling.
Especially when you're in a position where I can't do anything to help. You're helpless.
The Johnsons are among 1 in 4 older adults the CDC says has reported some type of mobility problem. And each year, millions of those older adults fall, with 20% of those falls causing serious injury.
For many seniors, it takes 1 fall to start a downward spiral.
Cindy Felice is the chairman of the Manatee County Falls Prevention Coalition in Florida. She says for senior citizens, a fall can compound underlying medical issues.
They may have been going along just fine, managing all their comorbidities and their issues, and then 1 fall can kind of tip the scale.
The National Institutes of Health echoes Cindy, saying in older people, the quality of life may deteriorate significantly after a fall, because there may be fear of a repeat fall.
We know that once somebody has 1 fall, this greatly impacts their balance confidence, which could lead to decreased activity.
Timothy Bissonette is a physical therapist.
Walk to that red dot, turn around and come back and sit down.
He says preventing a fall in the first place is crucial.
Regular involvement in exercise, strength training, balance training, staying active lifestyle, active in the community.
You can grab that to pull yourself up, steady yourself here.
Back in Ohio, Akron firefighter Mike Fuller spends his day going room by room looking for fall hazards inside the Johnsons' home and making small improvements like installing free grab bars around the stairs and showers. It's all part of the Akron Fire Department's REACH program to help seniors who have fallen and called 911 for help.
I think the more people that have these devices in place, the less time they're going to fall, the less time they're going to call 911.
It's also allowing people like the Johnsons to stay in their homes.
So when I came to ask him how much is this going to cost, and he says, well, how about a thank you and a smile. So, big smile and maybe some tears, but thank you.
The CDC says it's important to remember that falls are not a normal part of aging. To prevent falls, the agency suggests that you talk to your healthcare provider about risk and prevention. Remove clutter from around the house. Also, exercise is another key to preventing falls because it can improve your strength, balance, and endurance. And make sure to get your eyes and feet checked once a year. Poor vision and improper footwear can increase your chances of falling.
Researchers at UC Health in Colorado found another sense can contribute to fall risk. The study shows people who had trouble hearing cut their risk of a fall by as much as 50% by wearing hearing aids. That's when compared to those who didn't wear hearing aids. While more studies need to be done, researchers say it could be connected to balance in the inner ear.
Their brains are using so much cognitive power or resources to be able to understand, to hear, that those resources are redirected to that as opposed to being able to use it to navigate their environment.
Besides a decrease in falls, hearing others increases older adults' chances of staying engaged and socializing, and there is less chance of isolation and depression.